Hi everybody, it's Jennifer Schultz, Senior Vice President of Marketing and Communications, and we're back with another episode of Oklahoma Health News, powered by OU Health. Very excited today to have with me Dr. Raymond Cohlmia. Dr. Cohlmia is the Dean of the OU College of Dentistry and the President and Chair of OU Health Dentistry. Welcome and thank you for joining us today.
Thank you, Jennifer. Thank you so much.
It's so nice to have you here today. You know, there's so many things that have been happening in the last year with COVID-19. And one of the things that I think people are doing is they're saying, well, I might not come in for certain types of routine care because it's a state of emergency for healthcare. I don't want to, worry about getting COVID when I go in and things like that. We're seeing this everywhere. And so wanted to really talk to you today about that in the field of dentistry because there's a lot happening in that space. So I think maybe my first question is, tell me about if it's safe to visit my dentist and what makes it safe to go.
Jennifer, that's a really good question about the safety of dentistry, and it's extremely safe. In the last several months, we completed the American Dental Association Science and Research Institute. It's an organization of over 60 research and scientists, did an exhaustive study that actually measured the true transmission rate between patient and dentist in the dental office, and they found that almost negligible. It was almost even traceable, less than 1%. It was so low that we couldn't even detect any transmission, so it's extremely safe. Jennifer, dentists have created infection control because they have to manage an office that manages all of the sterilization aspects of it to make sure everything is perfectly compliant. So one of the safest places to be is in the dental office. I've stated to you on campus many times, one of the safest places to be is the College of Dentistry. The steps that we're taking to ensure the safety of the patient are unsurmountable. I mean, it's amazing what we're doing right now. So it's extremely safe to go to the dentist, and we now have the research data through the American Dental Association Science and Research Institute that backs up that safety is there.
Well, and I think about when we first entered into this COVID-19 journey, a lot of dental offices were closed for a period of time because they were saying these are elective type procedures, and you would have your mask off and your mouth open. But really, at the end of the day, there's so many protocols that the staff is using that when you, the patient, take off the mask, it is a very safe environment. Tell me a little bit about some of the things that your staff is doing as far as their PPE and the way in which the protocols look.
Well, as far as our staff and faculty, we do the same protocol for everybody that's in the entire building. Of course, masking is critical, but we do the gowns, we do the masks, we do the glove wear, we wear the head booties, we wear the eyewear, we wear 2 masks and double face shields. So anytime patient care is involved, the standard is consistent no matter who you are. And as a matter of fact, if you're a patient, which we manage many patient visitors each day through the college, that you have to have a mask anytime that you're in the building. We do a basic survey of questions to each one of our patients to do a little background check. We also do the temperature check to make sure that the patient feels healthy, that they haven't been exposed before we try any treatment. So we believe at the college, as well as most of the dental profession, is that you don't exempt your staff or anybody individual. We follow a strict protocol and compliance procedure for everybody that applies, and that includes me. So I follow those protocols and procedures because we lead by example. So that's why we do it consistent across the board.
Now, we've had conversations on this program about what happens if you delay care around mammogram screenings, colonoscopy, and things like that. Sometimes people can say, well, it's just, I'm gonna go to the dentist in 6 months. I'll brush my teeth really well and floss. What happens to us when we delay dental care?
It's interesting you would mention that, Jennifer. I was talking to one of your associates that I had a patient last week that had said, I was actually thinking of not coming in, doctor. But after visiting with you on the phone, I understand that it's safe. And we came here and I told the patient, I said, well, I have good news and I have bad news. The good news is I'm glad you're here. The bad news is I have discovered a lesion that needs to be addressed immediately. And so we had to take the patient, to get it biopsied to make sure that it indeed, and unfortunately I know that it's going to come back with not such a good positive report. So, but we feel that we can take care of that patient, and had that patient delayed or waited 4 or 5 months, I'm not sure if we could have managed it as well as we did right now. So it's important because oral health care is critical to a part of your body. The oral mouth as I was telling one of your associates, is that we used to put nitroglycerin tablets underneath our tongue. Anything that goes underneath your tongue has an immediate access to the bloodstream. So if your mouth is healthy, most commonly your body is going to be in a healthy state, and vice versa. You know, we detect more things in the dental chair. I detect diabetes, I detect leukemia, routine problems all the time, just by taking a look at a patient's mouth and saying, something's not right. I would like for you to see your medical care practitioner right now to make sure. So it's important that you see your dentist on a regular basis. You know, we talk about non-emergency care. Well, that's what actually we by taking care of yourself, by doing regular maintenance, is what makes sure that your future is strong, bright, and very healthy.
You know, one of the things that you'll read little tips and tricks in magazines or what have you. I'm not a scientist, so this is for all my friends out there. I remember reading that when you floss, it actually makes your real health younger. And I'm assuming that what that correlates to is there's something that happens when you floss your teeth that creates an environment in your mouth that makes it healthy. Tell us a little bit about what that is.
There's two factors that's involved with flossing. First of all is that when you floss, you remove the debris, which is usually laden with bacteria in between the teeth. And if you have bacteria present, that means your tissues, your mouth, your body has to fight that bacteria. It's an additional load on your body. The second factor is the physical massaging aspects that it does to the gums. It creates the gums in a vibrant, it stimulates circulation, and so it keeps a better, your gums look much more healthier than what they would be before. So flossing does two aspects. It's critical. We can actually tell a patient that flosses than a patient that doesn't floss on a regular basis. It's interesting because patients will say, do you floss regularly? And I don't ask that question anymore because regularly may be twice a year, you know, when they come before the dentist. And so now I say, do you do this on a daily basis? But you can tell. Again, the two factors are it removes the bacteria, it removes the material that's excess between your teeth, it keeps the gums from receding, and secondly, it stimulates the gums for vibrant health.
Now, the OU Health Dentistry faculty practice is a very robust practice. I know a lot of times people think of the training aspects that OU College of Dentistry does, but the faculty practice really is a growing practice that has maybe a bench to bedside or a research-based component. What does that mean when you are a patient and you go to see a dentist at OU Health Dentistry?
The OU Health Dentistry consists of faculty at the university that are usually doing research projects, teaching, and of course seeing patients. A strong educational program is only dependent upon a strong clinical program. So in other words, we have practitioners that practice dentistry every single day, and those are the teachers of our future practitioners that'll take care of our generations to come. So that's an important thing. So a better clinician makes a better educator, and a better educator is driven by a better clinician. So with OU Health Dentistry, we have several faculty members that are doing research at the same time, that are looking at the latest trends, the latest things that are out there in dentistry that are being practiced. And we actually not only establish a standard of care, but we test many of these products to see if they indeed are living up to the standard that the manufacturer says. So when you come to OU Health Dentistry, you're getting a top-notch standard of care for one. You're getting it done by the people that are doing the research in dentistry, and you're also getting care delivered by people that are teaching the future practitioners. We deliver today's dentistry today, to teach today's dentistry today, and that's what makes the strength of OU Health Dentistry.
Well, I do have to say, full disclosure, Dr. Cohlmia is my dentist, and there is an interesting capability that you have at the OU College of Dentistry that I think perhaps I've maybe experienced as a patient, which is it 3D printing or modeling or something like that to create different types of things you may need for dental appliances or what have you? Tell me a little bit about that.
We have a full 3D printing and milling laboratory that's actually, so we do much more digital than we do manual dentistry. Matter of fact, many of our night guards and our protective appliances are made through digital processes. So we are kind of one of becoming the leader of that area. We even print anatomical processes for the other colleges. For example, a college was going to do a surgery on a young child, and they wanted the model printed on the skull so they could look at the layers. So we did a three-dimensional x-ray or a three-dimensional scan, And then we printed all of these pieces for the medical college and put them all together so they could see the layers involved with this particular surgery. So it puts us on the leading edge. One, digital is being more accurate. Two, it keeps a continual record on the patient. But it's mainly efficiency of care and accuracy of care is what we're looking for. So digital is here to stay. As the president said, President Harris once said, is that I'm pretty sure that online education or digital education is not a fad. Well, he's indeed correct. And that's the same thing with dentistry. Digital is here to stay, but it avoids 25 or 30 fabrication steps, which errors can occur along the way. So instead of doing these multiple steps, we go from the scan basically to the product, and that provides the accuracy. It also gives us a lot more ways to measure so many more stats on the patient that we never did before using digital dentistry.
The other quick thing that I'm thinking about is that the research and the education aspects that you are doing at the college, that is another reason to go and just try us out, because you're going to get maybe a similar but also other types of benefits from going.
Agreed.
So I'm going to end with a question I always ask everybody, which is, do you have a tip or a trick for our audience about COVID, or do you have a ray of hope about COVID? Give us a little bit from your point of view.
I actually think, Jennifer, I was presenting to all the faculty, staff, and residents and students last week that I'm seeing light at the end of the tunnel. I actually am right now. With the penetration of the vaccine, which we all taken, to help us to continue to move along, I think as we penetrate the vaccine, as people understand more education about COVID, what it is, what it isn't, the transmission, that I think we're learning to manage. The question is will we go back to December of 2019? No, we won't. But we've learned so many wonderful things. COVID has taught us, as bad as COVID has been, it's also taught us how we can still meet. We can still get our accomplishments done. I was once asked last week, they said, what plans have you changed for the future of the college, be expanding to Tulsa and our pediatric residency, everything we're doing? The answer is nothing. We haven't changed anything. COVID is a slight obstacle. It's not a goal. So I do see light at the end of the tunnel. I see excitement. I see us starting to be able to travel again and starting to become part of a regular community again. We're almost there, Jennifer. We're almost there. We're just, as I say, I see the light at the end of the tunnel, and I'm excited as we approach.
Well, thank you, Dr. Cohlmia. Always a pleasure. Thank you so much for your time today. That is all that we have today for Oklahoma Health News. We're going to be back here again next week. If you have any topic ideas or questions, always send us a direct message or post on our Facebook channel, and we will see you again soon.